addiction, it could be a very complicated process to figure out how to get help. But today we have an expert with us to talk to us about it. It's Dr. Jorandby with Lakeview Health, and they're actually partners with us with the Opioid Nation, is a partner with Channel 4. So welcome to River City Live. And this is a really, it's a touchy topic because a lot of times, if, again, it's someone you know, you don't really know how to help them out, how to navigate this path, if you will. So let's just start out. How do you even identify this? How do you identify addiction in someone?
Well, that's a great question, Mark. So we actually encourage people to really look out for behavioral signs. Things that come up with a loved one where their lives are affected, whether they're missing work, whether they're missing school, their relationships become really conflicted, they're having a lot of arguments, or they're not showing up for responsibilities. And so those are the things, so those are the key things that we look for with addiction. They're using a substance more frequently. They're using it in ways that seem very dangerous. We also work with people at Lakeview Health where they're professionals, so people that are under high-stress positions. We treat doctors, we treat attorneys, nurses, and those folks are going to present a little bit differently because they're going to try and hide it a little bit more.
I was going to say that, especially a physician, well, obviously they know the signs and symptoms, and a lot of times with addiction, it's hard to talk about, and they're not going to disclose really what's happening. Exactly. And I think that's the thing, is really chipping away at that to understand it, because the communication is not there.
Exactly.
Now, when it comes to addiction, there's a lot of different types of things you can be addicted to. So what type do you treat and help out with?
So we at Lakeview Health treat a variety of addiction. We are treating many different substances, so opiates, stimulants such as cocaine, methamphetamine, alcohol, which actually, even though opiates in our country have become the main topic of conversation, alcohol still kills more people every year. So those are the core things, but we also see people that are struggling with marijuana use. We're going to see people that are dealing with what we call behavioral addictions, eating disorders, gambling, even pornography addiction. So we're really embracing that whole area. We also see people that are dealing with mental health problems, such as depression, anxiety, even trauma.
And, you know, you see hand-in-hand as a correlation. When there is a mental health issue, sometimes people will self-medicate, and that's a driving factor. And that's why a facility like Lakeview Health would help out, because usually there's an underlying reason why. And I feel like that's something, like there's the chemical dependency side of things, depending on the addiction, but also the understanding is, well, what's the driver with this? So how does it work as far as, like, let's just say you have a loved one, how do you introduce them to you?
So I think it's important to have that conversation with somebody. Sit down and tell them, listen, I'm worried about you. I see things that make me a little afraid. You're doing things that might seem dangerous. You know, have that frank conversation. It's going to be difficult, and you might get a lot of pushback. They may not want to hear this. And so I think the next thing would be to talk to a doctor or a professional, even if you go without that loved one, and you just talk with a doctor on your own and say, hey, listen, I'm concerned. I have a family member that's struggling. Help me out here. Because most docs, especially psychiatrists, but most doctors now are very aware of addiction, and they know how to get people into treatment.
And the other side of it, too, is the collateral damage, as they refer to. So, like within the family, one person might be the addict, but the whole family is affected by it.
It's a domino effect.
Absolutely.
So everybody, the whole family, you've got turmoil in the house. People are, you know, yelling, and there's a lot of arguments and a lot of maybe even financial stress happening. It can really cause a lot of problems for everybody.
Well, right now I just want to leave all the information. So if people, if they are dealing with this, it's a great resource. The number is 904-531-3333, or you could look them up online, lakeviewhealth.com. Thank you so much, Doctor, for all your time and information.
Thank you for having me. Absolutely.
Right now, we're going to send it over to Eden.